Dr. Bhupesh Karthik sir, come forward, sir, please. So he'll be talking about the Arthrex Dermal Patch. Welcome, sir.
Good afternoon. I will be talking on the Arthrex Dermal Patch, which is not yet launched in India. So, financial disclosure, I have nothing to disclose. And these are what I do. More importantly, the post I hold is I am his friend. So he said, "You come and talk on this." I said, "I have a family meeting." He said, "Shut up and come. You have no choice." So I said, "Okay, I'll be here and try to do what I can do." So this is an acellular bioimplant basically. It is a decellularized regenerative dermal matrix. It is processed through this technology called matracell. Through this technology, they decellularize the human dermis and they provide us with an allograft, which is a collagen scaffold. This helps in ingrowth of the patient's own tissue. So why this graft? Because it supports cellular repopulation, and you have revascularization into this graft, and this is supported by this article. So decellularization is the process through which we make an acellular scaffold. Why Arthroflex? Because it is ready to use. It is hydrated, which gives a good environment for healing. It is sterile, off the shelf, can be stored in room temperature up to 3 years. Because it is decellularized, 97% of the DNA is removed, so it is biocompatible, no adverse reactions and no graft rejections. Because it is dermis, it has excellent suture retention and strength and an intact framework which will not cut through. The process of decellularizing is called the matraheel. This is their patented technique. They remove the donor cells and the DNA without sacrificing the strength or the biomechanical properties of this graft. It undergoes 3 processes, series of washes and soaks to remove the cells. Then antibiotics and detergents are removed by rinsing, and it is hydrated so that it can be stored in room temperature for up to 3 years. For the orthopedic mind, this is how it looks. It is a acellular, extracellular matrix, lot of pores, so lot of good tissue can go in and heal into this porous coat. For the non-orthopedic mind, this is how it looks. All the cells are removed and there is extracellular matrix. I don't think we understand a lot of this, but you have to understand that it is porous. Only the ECM is there, cells are removed. Because cells are removed, there are no DNA residues, and the first 3 columns show the ECM, the extracellular matrix containing the collagen, and the last 3 shows the growth factors. So there is conductive property and a bit of inductive property with this. One of the patients who had a re-injury, a biopsy was taken, and then they found fibrocartilage, blood vessels, and tendon-like structure which grows into this graft. This is how it looks. The dermal side will go towards the rotator cuff, and the basement side will go towards the acromion for you to use it. It gives excellent security. They have done this study with other meshes and gives good strength. So basically, to summarize, it's a strong collagen scaffold. Fibroblasts of the patient will infiltrate and will deposit, and collagen gets deposited. Neovascularization happens. It can absorb blood and growth factors at the repair site to promote and give you a good healing environment. Arthrex suggests to use this for partial tears where repair of the tear is not done and then you just put on the graft, or for full thickness tears where you repair and then you put it on lay as discussed before. There is remodeling, revascularization and recellularization, and this comes in various thickness. The 3 mm can be used with the maximum strength. I have another minute. So it can be used through the posterior approach or the lateral approach, and you have your meniscal suture like anchors, fiber stitch anchors that will, for the rotator cuff, that will go and secure it medially, and laterally you can secure it with your self-punching push lock anchors. So that is how you secure these grafts. Arthrex also asks us to use it as a standalone graft for superior capsular reconstruction with the 3 mm. There is data yet to come to support this, but this is suggested by Arthrex, and that's how maybe it would look. Thank you.
Yes. Any questions, sir? Please. Bhupesh, the question.
Sir, any data regarding aseptic inflammatory response in this?
Sir, of the literature that I studied, because we have not used, it's not in India, of the literature that I studied, there is no, everything looks flowery from the literature, but time should tell us if such things can happen. On a theoretical note, maybe no, because there is no DNA, there is no cells there, it is only a extracellular matrix with collagen, wherein the patient's tissues can grow. It is a beautiful scaffold, that is what literature says.
It can be used as a load sharing as well, what you...
Yes. And because it is dermis, the strength is going to be good. It cannot cut through and come.
Thank you.
Thank you.
Thank you, sir.